starts with a positive pregnancy test. Over the next 9 months, your body will change more dramatically than it will at any other time in your life. Bones will shift position, organs will be displaced, muscles will stretch to accommodate a growing human. Ligaments will become loose enough to allow your pelvic to expand. These changes are necessary. They're how your body makes room for a baby. Then birth happens. Hours of intense physical stress on every tissue in your pelvis, hip, and core. Baby is born, it's over. Or is it? Your body is now supposed to recover. You get a 6 weeks checkup. Everything looks fine. You're cleared for normal activity, but nobody tracks what happens to your biomechanics over the next months and years. Nobody asks, did your pelvis return to its original position? Did your core muscles reactivate properly? Did your movement pattern normalize? Did your pelvic floor heal functionally, not just structurally? These questions aren't asked. This timeline isn't tracked. 2 years later, when it becomes chronic, nobody connects it to pregnancy because nobody documents the biomechanical timeline. Nobody established what normal recovery looks like. Nobody tracks where things went wrong. So chronic pain becomes just part of being a mom. Inevitable, but it's not. Let's walk through the actual biomechanical timeline of pregnancy. What happens to your body month by month? Your first trimester, between month 1 and 3, hormones surge immediately. Relaxins start being produced. This hormone loosens all your ligaments. Why? Is to allow your pelvic to expand and shift, but it affects all your joints, not just your pelvis. Every joint becomes slightly less stable. Your body adapts by relying more on muscle control for stability, changing movement patterns slightly, and you adjusting posture. These changes are subtle. You might not even notice them, but they're happening. Your second trimester is between months 4 and 6. Your belly starts growing noticeably. Your center of gravity shifts forward, and to stay balanced, you tilt your pelvic forward, anterior pelvic tilt, increase the arch in your lower back, lumbar lower dorsal, and you shift your rib cage back. Push your head forward. This creates the classic pregnancy posture. Muscles adapt to these new positions. Your hip flexors shorten and tighten. Your glutes lengthen and become inhibited. Lower back muscles work overtime, and core muscles stretch and separate. These aren't temporary accommodations. Your brain is learning these as the new normal pattern. Your third trimester is months 7 to 9. This is maximum biomechanical stress. Your belly is at its largest. You're carrying 25 to 35 extra pounds, mostly in the front. Your pelvic continues to shift and widening. Your SI joint connecting your pelvic to the spine loosens significantly. Pubic symphysis, so it's the cartilage connecting pubic bones, soften and separates, can separate several centimeters. Core muscles are maximally stretched. Abdominals stretch thin, often separating in the middle, especially non-functional for stability. Pelvic floor is maximal stretch. It's supporting increasing weight from above. Stretch downward by growing uterus, preparing for birth by becoming more elastic. Movement patterns are maximal altered. How you walk is completely different. You're probably waddling at this point. How you stand up from sitting, how you roll over in bed, how you bend down, everything has changed. Now, birth hour 0. If it's a vaginal birth, your pelvic floor stretched beyond what seems physically possible. Possible tear of the pelvic floor muscles, nerve damage in your pelvic floor, and pubic symphysis separates maximally. If you had a C-section, your abdominal wall cut through, uterus cut through, fascia disrupted, nerve damage in abdominal wall, and muscle cut apart. Either way, massive tissue trauma has occurred. This is the starting point for recovery. Let's compare what should happen postpartum versus what's actually happening. Week 1 to 6 is immediate postpartum. Your tissue healing, so your uterus is contracting back down, bleeding has stopped, tears or incisions are healing, acute inflammation resolving, early movement restoration, so you get your gentle pelvic floor awareness, basic core activation practices, posture correction, and movement pattern re-education. Professional assessment is diastasis check, pelvic floor evaluation, movement screening, and core function testing. What actually happens? Tissue healing? Yes, this happens. Movement restoration, no professional guidance. Assessment 1, brief 6-week checkup, checking if tissue is healed. Your result is tissue's healed, dysfunction persists, nobody notices. Months 2 through 6 is the early recovery period, and what should happen is progressive rehabilitation. Week 6 to 12 is core and pelvic coordination training, gentle strengthening, movement pattern retraining, breath movement coordination. Weeks 12 to 24, passive strengthening, return to activity guidance, specific sport and activity preparation if needed, and regular assessment and adjustment. What actually happens is at 6 weeks, you're cleared for normal activity. No rehabilitation provided unless patient specifically seeks it out and can get insurance cover. Women tries to return to pre-pregnancy activities using dysfunctional movement patterns, core not function, pelvic floor not coordinating, compensation everywhere. Might feel okay initially, but seeds of chronic pain are becoming planted. Months 6 to 12, late recovery period, what should actually be happening is continuing monitoring. Function should be mostly restored. Movement patterns normalized, core and pelvic floor working well, any persistent issues addressed. If problems are developing, caught early, addressed before becoming chronic, prevented from worsening, what's actually happening is there's no monitoring. If pain develops, woman assumes it's a normal postpartum stuff. To give it time, hope it'll resolve. Doesn't seek help yet because she's told bodies take time to recover. She's busy with the new baby and she thinks she just needs to get stronger. Meanwhile, compensated patterns are becoming entrenched. Year 1 and 2 post-recovery period. What should happen is full function should be restored by now. Any remaining issues should have been addressed. Women should be able to exercise without pain, pick up child without limitations, walk, run, play normally, sleep without pain, live without thinking about her body constantly. What actually happens is for many women has become chronic by now. Common timeline. Months 8 to 12, pain starts or becomes noticeable. By months 12 to 18, pain worsens and starts limiting activities. By months 18 to 24, finally seeks medical care. Why does this take so long to seek care? Because women are told postpartum pain is normal. Busy with baby, putting self last, hoping it'll solve on its own. Not sure it's bad enough to warrant seeing a doctor. By the time they seek care, 18 to 24 months of dysfunctional patterns. Compensation deeply entrenched. Tissues have adapted to altered loading patterns. Much harder to fix than if it caught at 6 to 12 weeks. Year 2 plus chronic stage. This stage shouldn't exist. Pain should have been prevented with proper early intervention. What actually happens is a woman is now in chronic pain. Sees doctor, gets imaging. Imaging is normal. Told nothing is wrong. Or gets generic treatment that doesn't order the root cause. Pain persists. 3 years postpartum, 4 years, 5 years, still in pain. Has accepted it as just part of being a mom. Has accepted it as just part of mom life. The timeline that was never tracked, the progression that was never monitored, the dysfunction that could have been prevented. So let's look at other countries do differently. In France, they track this timeline. There are critical windows in the postpartum timeline. Windows where intervention works best. These windows and dysfunction becomes much harder to fix. So critical window number 1, weeks 0 to 6, this is an acute healing phase. Tissues are healing, but this is also when your body is establishing its new normal. Movement patterns are being set. Muscle recruitment patterns are being reinforced. What should happen is gentle movement guidance, awareness of core and pelvic floor, correct breathing patterns, avoid reinforced compensation. What usually happens is no guidance. Body forms whatever pattern works, and compensation becomes the norm. Why this window matters is brain is most adaptable now. It's easier to establish a good pattern than change bad ones later. Critical window number 2 is week 6 to 16. This is active recovery phase. Tissues have healed acutely. Body is ready for active retraining. Relaxins and other hormones still somewhat elevated, especially if breastfeeding. So what should happen is your core and pelvic floor retraining, movement pattern correction, progressive strengthening, building new motor programs. Why this movement matters? This is when problems are still easy to fix. Between 6 to 12 weeks of focused work now prevents years of chronic pain. But most women don't get this intervention. Critical window number 3 is month 4 through 12. This is late recovery phase. Hormones are normalizing. Most women return to higher levels of activities. What should happen is functional assessment before returning to impact activities, progressive loading, sports-specific preparation, and monitoring for problems. What usually happens is women just start running or exercising. No preparation, usually dysfunctional patterns, and overload development. Why this window matters. This is when chronic overload patterns typically develop. Pain might start during this window, or damage accumulates and pain starts months later. Critical pain number 4 is year 1 to 2. This is consolidation phase. Whatever patterns exist now are becoming deeply ingrained. If dysfunction exists, becoming chronic. Tissues adapt to abnormal loading. Compensation patterns automatic, but still a window for effective intervention. Requires more work than earlier windows, but it's still achievable. After 2+ years, it's much harder to change. Not impossible, but requires significant effort. Years of dysfunctional patterns need to be unwound. This is why timeline tracking matters. Catch problems in early windows when they're easier to fix. Don't wait until they're chronic, but US model doesn't track the timeline. Critical windows are missed. So why doesn't US medicine track this timeline? Several interconnection reasons is the medical specialization. OBGYN owns pregnancy and immediate postpartum through 6 weeks. After 6 weeks, postpartum monitoring isn't their domain. Orthopedic owns musculoskeletal pain, but they can't see patients while pain develops, often years later. Nobody owns the timeline between these points. Insurance pays for managing complications, doesn't pay well for prevention. 1 6 weeks postpartum check covered. Multiple postpartum functional assessments are not standard coverage. Preventative PT before problems develop is hard to get covered. Reason number 3 is no standard protocol exists. There is no official US guideline for postpartum function recovery timeline. Professional organizations haven't established what should be assessed, when it should be assessed, what indicates need for intervention. Without standards, there's nothing to implement. Number 4, cultural expectations. American culture expects women to bounce back quickly, doesn't support extensive postpartum care. Maternity leave often is only 6 to 12 weeks. There's no ongoing support. Women are expected to be fine after 6 weeks. Tracking recovery probably would require multiple appointments, time off work, prioritize maternal recovery, not culturally supported. Reason number 5, lack of urgency. Medicine focuses on immediate life-threatening complications, hemorrhage, infection, blood clot, severe high blood pressure. These require immediate attention. Long-term functional issues, not life-threatening, and develop gradually and not urgent, get deprioritized. Even though quality of life impact is huge. Here's what the timeline should look like. Between week 1 and 2, home visit. check on the basic recovery movement, early warning signs, educate on core and pelvic floor awareness. Week 6, comprehensive assessment, pelvic floor, core, movement, posture, baseline documentation, begin rehab if needed, or preventative exercises if all is well. Week 8 to 16, active rehab, core, pelvic floor, movement retraining, 8 to 12 sessions of pelvic floor PT and progress tracking. Month 4, functional assessment, return to activity clearance based on function, not time. Sports specific prep if needed. Month 6, check in, functional maintenance, issue development, address early, problems emerge. Month 12, final assessment, full recovery confirmed, or ongoing issue addressed. This isn't complicated. This isn't even that expensive compared to years of chronic pain management. It's just not how we do it in the US. So the timeline goes untracked. Women fall through the gaps from pregnancy to chronic pain in progression that entirely preventable. Someone was watching if the timeline was tracked, but it's not. So the pain becomes just part of being a mom, and the timeline that explains everything remains invisible.